Okay, folks, we're going live again. Bring him on in. Oh, I'm getting cut off here, Lonnie. You might have to put that camera up a little bit here. So
that's just his head. We don't need to see his face.
There we go. There we go. All right, folks, we're going live again on YouTube and Facebook. Hi, I'm Bob Schrupp, physical therapist.
Brad Heine, physical therapist.
And together we have the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Brad, today we're going to talk about how to get rid of neck hump using physical therapy exercises, posture exercises.
Right.
Now, we're not talking about dowager's hump, which is more of a hump that occurs more in the upper mid-back. This is a hump that is basically, neck hump has been kind of the definition that has been widened now to include people who are having difficulty with their posture and at prolonged periods of time. You can also get neck hump from Cushing's disease, steroids. It could be a lymphoma. It could be a compression fracture. But I wanted to show on the spine here real quick, Brad.
Bob, am I wrong to say that this contributing factor is poor posture with being at a computer, using your
Absolutely, Brad. Yeah, yeah. And what we're seeing, by the way, we just saw a study that they did some scans on younger people that were 20 years old, and they found out their neck had deteriorated to the similar as to people who had been working for 40 or 20 years already.
Right.
So I mean that were 40 years old, and I mean so.
Right. So we're talking about things with the disc and the bony structure of the neck and the stretched out soft tissue.
Computers, iPads, everything that's bringing your head forward here, and the phone. Everything that's bringing your head forward here is causing this neck hump to be created.
And along with injuries that affect the neck, shoulders, and arms.
Yeah. So it's a head forward posture. The shoulders are rounded and the back is curved.
Right.
So that's all these exercises that are trying to help correct all those problems. But again, you can see if this, here's the neck, the first 7 bones. If that's forward like this, I don't know if you can see this bump here. Is really
bring it in, Bob. Bring it in.
The bump is really going to stick out, and that's what you're seeing with neck hump, and that's what we're trying to correct.
There's always that one bump that is prominent, okay, and that one even gets more prominent with this problem.
Right. So, by the way, let's take care of our laundry here. Yeah, let's take care of business.
Take the dirty laundry.
By the way, if you are new to our channel and you're watching this on the rebroadcast, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. And if you're not on Facebook yet, if you're on Facebook right now, give us the heartsies and the thumbsies, right?
The heartsies dance across.
Yeah.
And the thumbs up.
If you're not on Facebook yet, please join us over there. We got Brad have a severe disease.
Spit it out. We like to be liked. That's what he's trying.
We like to be liked, but also today you need to go over to Facebook because we are giving away. Do we have it now?
I'll get it.
Brad's gonna go get it. We're giving away a Waxwell paraffin bath. This thing's beautiful. I mean, we did a whole video on it. You're not gonna want to miss out on this, and just for the next couple of days. Boy, Brad almost tripped with that. All right, so this is Oh, this is. He's giving we better show on Facebook too, Brad.
Oh, the faces. Yeah, heart season, leg season, we got it.
So it's full
before midnight tonight.
It's full of paraffin and it'll warm up your hand, give moisture to it. We did a whole video on it. You're gonna like it. So, all right, Brad, why don't we go ahead and get started here? Let's start off. The first thing you're gonna do is we gotta start correcting. I'm gonna show you some exercises you can do throughout the day, and then I'll show you some exercises you maybe do once a day. So the first 3 exercises are ones you can do as you're watching right now and even throughout the day. The first one, you're probably sick of us doing this one, is chin tucks.
Right.
So because you just simply, the big problem is the head forward, so you're going to work on tucking your chin in and bringing your neck back. You're not dipping down like this. You're not dipping up like this. You're just going straight back.
And you'll notice everything down here straightens up as well along with it. So it's not just doing the neck, but it's getting the upper back as well.
Brad, why don't you bring the 2x4 out?
Yeah, and you want me to hit you with it?
Yeah, let's go ahead and let's do a little violence on it.
Do the hump posture for
All right.
Okay, so here we got the rounded here, the head forward.
Chest is depressed and tightened. So now by doing the chin tuck, I'm tucking my chin in and I'm backing up my ears, and you can see I'm correcting. I'm getting back straight again.
Right. I'm thinking if we tape this 2x4 to you and you walk around like that for a day, you won't have a problem.
I would be. I used to have a teacher like that.
Okay, carry on.
All right, next one, Brad. Very simple one to do. You're just going to bring your hands forward and then you bring your hand and squeeze your shoulder blades together.
Right.
So this is now working on that thing, you know, where you tend to be rounded out in the back. By bringing this back, you see how I straighten everything out? And I'm strengthening the muscles that are going to help me stay in that right position.
Right.
So we did the chin tuck, we do these, and now we can do hit the road jack. So you go back like this, thumbs up, and go like this.
Oh, I like that, Bob.
Yeah, thumbs, elbows back, thumbs up, hit the road jack.
And you get that external rotation. That's good for those rotator cuff muscles as well. So we're getting 2 for the price of 1. It's a great exercise combination.
Now, these first 3 are ones, like I said, you can do throughout the day. Now, you know, maybe people will look at you a little bit strange, but, you know, we're used to that.
Yeah, exactly.
Maybe you aren't, but we are.
Yeah, you will get used to it.
All right, next one, Brad. Now we're going to go ahead and do some exercise that you can do on your own, probably at home, probably on the floor would be the best.
Carpeted floor, probably?
Yeah. Mm-hmm. So we're going to start off with, can you take a rolled sheet or a towel? And you can certainly make it bigger than this too. You could take even 2 towels. I can see I have white on white here. So
right. Yeah, if you got it up here, there you go.
Yeah.
This shows that we've got a.
Yeah, this one is not that thick. I probably would have it even thicker. You're going to pull something else out? I won't have it that thick.
That would be too thick.
But
it could work for some people.
I think I like the tape idea though, Brad.
Right.
Because if you're going to use it all the time, but we try to save all of your money all the time. So where this is going to, let me show on you, Brad, where we're going to put this. Usually like right below the shoulder blades or right on the mid-thoracic area, mid-back, and it's going to help correct that rounding out by making it go the opposite direction.
And this is nice because gravity does the work. You relax and let gravity open that chest up. And it's, you know, typically quite comfortable, and you can feel it open up that chest and get the shoulders back where you want.
Things are already starting to stretch.
Sure.
And now I can, and this is a good time to work on your breathing. We've done some videos on that already too. But now you're just going to go ahead and bring your arms up, palms, and just let them relax to the side while you're breathing in through the nose, out through the mouth, up and out.
Now, Bob, I do want to bring up a point. There are going to be people who already have contracted necks, and they're not going to be able to get their head down. It's going to be painful, and you're not going to be able to get your head down. So you're going to have to put something there.
That's probably too much.
That would be too much.
Probably just another little towel, Brad.
Yeah, exactly. Here.
Yeah, if you can't get your head down, or you're like this, or you know, you're going to want to have just a slight towel, and over time, hopefully, you'll be able to work your way down.
Right, so you don't need that extra support. Then you know your posture is going to be right on.
Now, you know, after doing 10 of those, I'm going to go more to the Y position. Why, Brad? Why?
Why, exactly. Why?
Okay, and then finally, you're going to finish up with the Superman or Superwoman.
Well, of course, yeah.
You know?
Right, they got that good movie out now. I
That's
didn't watch
right.
it yet.
Wow, I'm surprised you know that. You don't usually know pop culture, Brad.
I know. Well, I heard about it. Well, I'm not going to tell you where I heard it, but anyways, I heard about it.
Okay. All right. Next one, Brad. Where are we at? Let's see. Oh, now we're going to go ahead and do some standing ones, Brad. Let's go ahead and stand or sit. You can do this one. All right. You're gonna let's stand.
Yeah, I'm ready to stand. I'll show from this direction.
Okay. You're gonna link your thumbs together. You're gonna pull and you're pulling them apart while you're doing it.
Pulling this way.
Yep.
So not really hard,
But we're trying to activate some of these muscles back here.
That makes sense.
So you bring it up like this, and then you're going to lower it down. So link the thumbs up.
Imagine we incorporate some breathing in with this.
And then lower it down. Palms are going up.
Relax.
Yep, breathing with this is exactly right, Brad.
Breathe in as you go up, exhale as you go down. How many times, Bob?
Oh, again, you can do 20 of these if you want.
I would probably do 5 to 10 myself because I'm not a patient person, but a little bit of something is better than a lot of nothing.
All right, well, we take the strap, Brad. The strap. And you got something you can use too?
I'm not going to use this.
All right, you can use, this is the stretch out strap. You could use a dog leash. You could use a long belt or a towel or anything like that. You don't need to go out and buy something for this, but you're just going to go ahead and you're going to go, I'm going to sit just because I can see the camera here is not going to pick me up, Brad. So you're going to bring it up over here like this, and then you're going to lower it down like this. Now, if you can't make it, if I go this far, I can't go back. See that?
Sure.
So you may have to go wider then, and then you can bring it back. And this just really opens up the chest, Brad.
And I think that's a benefit of using, if you got an elastic band or tubing, the tubing, I get up to here and I can't do it, but the tubing compensates for it and allows me the right.
And you actually get a little bit of strengthening with the tubing.
Yeah, you could.
Tubing or band.
Yep, you could actually do some of this in there.
Now you can also stretch a little bit going the other way, going this way and stretching up this way. It's just stretching some different fibers of the chest muscle. But boy, I'm really starting to feel relaxed, Brad, doing this. I mean,
yeah,
it really is starting, open up everything. My neck's back, my chin's back. I'm starting to get everything really moving quite well. By the way, Brad, we didn't mention, normally how we do this, we try to get through all the stretches, and then we try to take some questions at the end. So,
right.
We're going to kind of keep moving on here.
Right.
So,
I hope they were patient with that.
all right, now we're going to lay on the bed. We're going to remove the towel, and Brad's going to show what I'm doing. Because I'm going this flat like this, Brad.
Yep.
And we're going to go ahead and the key to this is you got to keep the contact with the arms, the hand and the elbow on the bed or on the floor. And you're going to move up one at a time. Can Brad be seen?
Mm-hmm. Yep, I'm on there, Bob. So I'm doing the same thing, except for I'm using the walls as opposed to the bed or the floor.
This can be difficult to do for some people. And I have trouble on this side. This is how far I get. And now I'm starting to creep up.
Yeah.
So this shows me that I have more difficulty on one side than the other.
My left side's tighter too, and
Oh.
I think we are both right-handed, correct?
Yeah.
And you may find that your non-dominant side is tight. Oh, Bob, just relax, would you? This is a family show. You're getting kind of weird now.
All right. And the next one you can do is you do a little bit of isometric strength. And you got the elbows kind of at a right angle here. And you're just going to push into the bed.
Oh. So you're going straight down. Right?
Yep.
You could do this long.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can even go lower. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The old joke would be 1, 2, 3, go lower. 1, 2, 3, 4, 5, 6, 7, 8. Okay, then you go up higher. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
I can't go higher than that.
All right, if you want to show, I'll show you some of the traditional ones. Lonnie, you want to throw me a couple pillows?
Throw them hard.
I think we just woke Lonnie up. She looked like she was in a daze there. All
I
right.
get bored of this.
Yeah.
I hope everyone out there.
Tell some jokes, Brad.
Yeah.
Keep Lonnie occupied. Can I get a rolled towel, maybe?
You want this one?
No, the other one, maybe the smaller one. There you go. Yeah. So you put a couple pillows underneath you, and we're gonna go Y, cross, reverse Y. So
if you're looking down at Bob, it's here.
yeah, I'm going palms down. These are a good workout. You're gonna have to talk, Brad. People probably can't hear me.
Well, okay. I'm trying to show them. I'm showing from
Oh, you're
this side.
showing
Yeah,
them?
yeah. Can they hear me? Can you hear me out there, people? And then we're going down. But yeah, we're working these muscles, the upper, middle, and lower traps, as well as there's other muscles too. All postural muscles to get those shoulders back, to get you looking.
Looks
good.
like I'm flying, doesn't it,
Right,
Brad?
so you can breathe well. Your shoulders are going to work well mechanically. Everything works better with good posture.
Now, eventually, you can actually take cans and,
Sure.
and do those with cans if you want to really get a workout.
Yeah, and
there.
if you happen to have 1 pound dumbbell weights, you could do that too. But we don't like to get too fancy.
Brad, why don't you look and see if anybody's got a question?
You want me to look, Bob?
Yeah.
Yeah, you keep talking.
And with those exercises, that last one, you can also, you do it palms down, but you can also do thumbs up when you're doing that one. So, Lonnie, did you have a question? You look like you have a question.
Well, what about how we can sleep if you can't on your back?
How can you sleep if you can't sleep on your back?
Yeah.
Is that the question? We have a couple of videos on this. I'm going to show you just one thing, one hint for sleeping like on your side. Because one thing we don't like you sleeping on the point of your shoulder. I need one more pillow though, Lonnie. I suppose we don't have it, do we? Oh, we do.
Yeah.
All right.
So I got the feedback. We're loud and clear, so that's good.
Okay. When you sleep on your side, this is just a little hint. You're going to have the double pillow here because you don't want your head to go this way or this way. You want it right in the middle. So if I only had one pillow, I would go like this. And so we use double pillows when you're on your side, but then you leave a little gap here for your shoulder. Now you can do this with a throw pillow or just a regular pillow, and you put your shoulder right in there, and now there's no stress on the shoulder, or very little. The neck is lined up the way it is. You can put another pillow between your legs if you want for your back. I know it's like pillow crazy, but it works out really well. And believe it or not, that's how I sleep, Brad. I got a throw pillow right here, and I sleep on my side that way. I just did last night. You act like you don't believe me.
I don't care.
You didn't really care. All right, do you have a question, Brad?
I hope you sleep well.
That was a way to sleep correctly, by the way.
How long should we do these, or how many repetitions did we set on some of them? But
all right, the one like the chin tucks and this one and the hit the road jack, you can do those, every hour, a couple of them.
sure.
The other ones, I would do it once a day. I would do a good. You can do it. You said 5 to 10, maybe to start off with.
Sure.
But you can work your way up. These are posture muscles. So
Yeah.
you can do high reps.
Sure.
You can do 20 reps if you want to work up to that amount. Good question, by the way. We don't, what we like about the people that subscribe to us and that like us, they're very smart. Did you notice that, Brad?
I know. We
They're
got
higher intelligence than normal.
exactly.
So-
Yeah. Well, our viewing audience is up above average. There's no doubt about it.
Lonnie,
Are those exercises good for carpal tunnel?
are they good for carpal tunnel? Yes, they are. Let me explain to you why. A lot of times with carpal tunnel, there's a thing called a double crunch syndrome. So you got the nerves coming out of your neck, and they come down, they travel into the arm and into the wrist and into the hand. Sometimes they're getting pinched up in here, Brad, right, with bad posture. It's getting pinched here. So it's already, the nerve is sensitive, and by the time it gets down to the carpal tunnel area, and you got that band going across there, it's already sensitive, so now it's doubly sensitive.
It's already compromised.
So-
I'm in here, by the way. They couldn't
Yeah.
see me.
So when we stretch all this out, we're leaving more room for the nerves to travel, and there's less pressure on them.
Sure.
This is one of the first things we do when we treat carpal tunnel, is we make sure they're having good posture.
Right, you got to start from the beginning
Yeah.
and work down so you don't miss something. We
Yeah.
got people saying hello from United Kingdom, UK.
We love the UK.
Yeah, people from Pakistan.
We
got
love
them.
Pakistan.
Yeah, keep them coming. A
So,
lot of highs and congratulations and things like that. I'm looking for some questions, but we love all the feedback and people saying,
Lonnie's rolling her eyes. So any more questions, Lonnie, on Facebook? No, we're good on that.
what does LMAO mean?
Laughing my
Oh,
butt off is what they're saying.
yeah, someone said that about I don't care.
So I think we're maybe wrapping it up, Brad, or anything quicker here we got.
Yeah, we got someone from Canada. Someone's asked about knee pain, but we're not going to get into knee pain. We'd love to do it, but we'll have.
We got
some
lots
that.
of videos on knee pain. Just, there is that little search thing on our site.
Right.
Just take a look on that, because we've done a lot of videos on knee pain.
Yeah, just put in knee pain for that, and it'll pull up our videos for that specifically. But right now, we don't have the time for that. How we doing, Bob?
I think we're good.
Yeah, we got patients
Oh, he's
waiting for us.
asking
and-
how-
Oh, wait, one more
How about
question.
kyphosis?
How what?
How about kyphosis?
Oh, kyphosis. Lonnie's, this is a question, kyphosis. This is good for kyphosis.
Right.
Again, you're going to do what your body allows you to do, but this is wonderful for kyphosis, and you really want to avoid doing flexion activities, because especially sometimes kyphosis is caused by a compression fracture.
And for those who don't know what kyphosis is, it means the mid
Yeah,
back.
rounded out like this.
From here to here, this section of the back is rounded forward. That's known as kyphosis.
Remember we used to have that little,
That's thoracic kyphosis. I'm assuming
remember
that's
we
what
used to
they're
have that
talking
little squeeze thing? That little, we represented a vertebrae, and we could squeeze it down to show how what a compression fracture looks like.
No, I don't
Okay,
remember that. Bob.
never mind. All right, I want to thank again everybody for watching, and please catch us again next week.
Take care.